Now, so we will simply start our examination just like our classical abdominal examination in case of the anastomotic leak. Now, the CRISP, we have to follow certain protocols. So we started with the swinging movement. Yes, that's important in case of the both of the things. Now, first, we have to start with the airway. Okay. The first thing we will notice here, I am going to give you a simple structure, what you can follow, and you can complete this within 6 minutes. Okay, so listen very carefully. We will start with the airway, and the first question should be in our mind: is the patient is talking? Okay, if yes, then what do you will think?
Airway is patterned.
Excellent.
Airway is clear,
patterned.
no obstruction.
Yes. Okay. The patient is having shortness of breath. Okay. So what we have to give? We have to give the patient high flow of oxygen with using almost 15 liter per minute. Okay. With using a non-rebreathable mask. Now we have to merge the airway and the breathing. Okay. So what is the tricks is here? You merge this by asking, can I check the patient's saturation by doing a by putting a pulse oximeter? And can I have the chart for the respiratory rate as well? Patient is having shortness of breath. So you give the patient 50 liter of oxygen. So you need to reassess your situation, right? What is the condition of the patient? So you are merging this with that, right? So you are merging between the airway and the breathing. So airway is done. So, okay. In the airway, we don't need to do anything else. Next, we have our B. B is for breathing. Okay. When we will have our pulse oximeter and the respiratory rate count is done, most probably there will be a sister or the examiner will act as a nurse. Okay. So in the breathing, you start with the trachea. You start with the trachea. Trachea, what we are going to see, the position. Very quickly, okay? You start with the trachea. Then chest expansion. You are looking at the chest movement, okay? So you can see that, but what are the things you have to do, right? So you need to check for the chest expansion. When you are doing the chest expansion, just you put your both of the hand on side of the chest and ask the patient, can you please take a deep breath for me? Deep breath, okay? Next, move on. You go for...
So sorry for interrupting you.
Sure.
Have I to expose the patient before proceeding on with doing the chest movement assessment?
Yes, you already exposed the patient completely. Before you start your examination, you completely expose the patient already.
Okay.
Okay, so after the chest expansion, you need to go for the percussion. Okay, so you need to percuss over the chest to see if the sound is resonant or not. Next, after the percussion,
chest expansion, you will have to measure it with a tape or just
no measurement
with the help of
with the only hand. Okay, only with the hand.
Stand.
Yes. Next is you have to go for the auscultation.
Hello, excuse me.
Yes, Dr. Anthony.
Percussion, which areas are you percussing? Anteriorly, posteriorly?
In case in the first place, you have to auscultate and also the percuss in the front first. Okay, first front. I will say you have to go for the back as well. Okay, so you start the percussion and the auscultation in the front first. Okay, so what are the points you are going to auscultate? Think you started with the this is one point, then move on to the second. Okay, and you are starting over the clavicle, right? From the apex of the lung.
Clavicles.
Yes. 1, 2. Supraclavicular region. Yes. 3, 4, 5, 6. And then this is 7. And this is 8. Okay. Very quickly. Very quickly. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Very quickly. Next, as the patient, can you sit up? I will be holding you. I'll be help you. Okay. Then again, go for the auscultation only on the back. Okay. On the back, go for the auscultation. 1, 2, 3. This is 3, 4, 5, 6, 7, 8, 9, and 10. Okay. So see how you can do that, right? By zigzag like this, like this. So it will be a little bit easier for you, right? Like this. Okay. So you are keeping your level horizontally for each side. Then you move down and keeping the horizontally for the same side as well. Okay. So just like that. 1, 2, 1, 2, 1, 2, just like simple, very easily. Okay. Next, you asked to do 2 things. You have put the pulse oximeter and also you have asked for the respiratory rate. So ask for that. Okay.
Excuse me.
Yes.
At the back, you did only auscultation. What of percussion?
No need. On the back, no need.
Okay.
All right. No need of the percussion over the back. Just you need to auscultate front and the back, both sides for just for auscultation. No need to percuss, and only you are going to percuss on the back in case of your respiratory examination. Okay, that's the classical respiratory examination. But here, no need. All right. So you asked to check the pulse oximeter and also for the respiratory rate. So you can ask about the saturation of the patient and also the respiratory rate of the patient here. Okay. Then you need to merge from breathing to the circulation. How you can do that? Simply ask, can I check the patient's pulse? And can I check the patient's blood pressure as well? Okay, so you are merging between the breathing and the circulation as well. Okay,